Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine. I'm both certified in internal medicine and lifestyle medicine. In just around 15 minutes, we'll bring you 5 key takeaways from leading experts and practitioners who are using evidence-based lifestyle medicine to transform patient outcomes. From practical strategies to success stories, we focus on the how of lifestyle medicine to empower you to make an impact in your practice and beyond. In this episode, we are honored to be joined by Dr. Cate Collings. Dr. Collings is a distinguished cardiologist holding board certifications in cardiology, internal medicine, nuclear cardiology, and lifestyle medicine. With over 30 years of experience in invasive, general, and imaging cardiology, Dr. Collings has transitioned her focus to lifestyle medicine. She has been instrumental in developing programs that integrate evidence-based lifestyle interventions into interdisciplinary clinical practice, aiming to prevent and treat chronic diseases such as diabetes, heart disease, and cancer. Dr. Collings is a past president of the American College of Lifestyle Medicine, served on the board for 8 years, and is a current delegate to the AMA on behalf of ACLM. In these roles, she advocates for the integration of lifestyle medicine into mainstream healthcare. Beyond her clinical and leadership roles, Dr. Collings is passionate about coaching executives and physicians to enhance their health and performance, thereby mitigating their own risk of burnout, modeling self-care for their patients, and influencing decisions about employee health. Welcome, Cate. How are you doing today?
Great. Thank you. Thank you for inviting me. This is great.
Oh. Well, let me start by mentioning that you have profoundly influenced my career, consistently offering your encouragement and support over the years. And it's truly an honor to have you here today as a guest. And so I'm really pleased.
Wonderful. I'm pleased.
Thank you.
Yeah.
So let me ask you about your journey into lifestyle medicine. After decades in cardiology, what inspired you to transition your focus exclusively to lifestyle medicine?
Well, I would think the number one reason is the evidence. And of course, before I got into lifestyle medicine, before I was in cardiology, I was in exercise physiology. And so I had experienced the life-changing effects of exercise in some of the highest risk cardiac patients. And what I found as I transitioned from exercise physiology to cardiology is we weren't bringing that information into clinical care. It was sitting outside the clinical model. So that was that lack of bringing what we knew about exercise in this case into clinical care became quite evident to me as I practiced, and it was an obstacle. And of course, as I went deeper into all the pillars of lifestyle medicine, more and more evidence was put in front of me, and it was harder to ignore that. We not know once we know something. I would say the other reason was because I practiced in a time when there were immense interventional and pharmaceutical advances in cardiovascular care. My patients didn't seem to be getting healthier.
Wow.
And while we could save somebody in these acute settings, in the setting of acute heart failure or myocardial infarction, this was wonderful. And yet my patients, in terms of their chronic care, came back with more procedures, came back with comorbidities that were also lifestyle related. So I actually saw their health worsen while we were saving their life through the decades. And I would say the third reason, and it was a profound reason, was again with this advancement in pharmaceutical care, polypharmacy, drug
Mm,
effects, drug interactions became more and more concerning to me. In fact, kind of terrifying, because we just layered on and tiered on medication after medication. And though, I still advocate that some medications are certainly necessary, it became very appealing to me to learn how to use the smallest amount of medication or this, the fewest numbers with the most compelling evidence and not worry about having to add, a medication for gastric reflux, a
right.
medication for this, a medication for that. Because when I went to look at drug interactions, right, they were just like terrifying, and then I go through all that with patients. So there were many reasons that I felt things had actually gotten worse within healthcare,
Mhm.
worse in terms of my patients' health, really health. And, learning about lifestyle medicine was a real breath of fresh air. I would say, made me optimistic that
Yes.
we could actually make a difference.
Yes. And I think we all resonate with that message of hope
Yeah.
that we see at the end of the tunnel finally. I know you worked on developing programs that integrate lifestyle interventions into clinical practice. Can you walk us through how you approach building these programs?
Yeah. Yeah. So I mainly worked, we now have very large health systems. I worked, I would say, at a regional level,
Mhm.
hospital and clinical practices, some attached to that hospital, but not a nationwide system. And that's just for the audience to contextualize when I'm talking about this. So the first program I developed, and this might be a good example about what not to do, and
Okay.
contrast that with maybe a better approach that, I was just young and didn't know really how to do this quite as well. Turned out okay. But I'll tell you, this is the cardiac rehab program that I started in the early 1990s. And at that time, cardiac rehab was not a strong revenue center for a hospital. Um, so you had to justify using up that hospital space for something that was not as revenue producing as
Mm,
lab or anything else. But what I did at that time, I was of course passionate about bringing this into clinical care. And so my passion carried me, and I had a few CEOs, but each time that would support me. But each time there was a switch in CEO, we had to go back and re-justify
mm,
the importance of this for patient care and how much patients liked it. And we sort of had that perspective of like, we're doing a great job for patients, but we weren't really looking at the bigger picture. So I would say the program goes on, and I was able years later to embellish that program by getting foundation support from our hospital. So I could bring in a nutritionist, I could bring in
mhm.
stress management training, and really make it a really comprehensive program. And it was very successful. And as we became a cardiac center of excellence, we now, and this is what I want to point out to the audience, they needed us. We didn't just want to plead for us to do what we were so passionate about.
Right.
They needed us to be a component of that cardiac excellence center in order to bring patients in the ambulance to our center.
Mhm.
So it became a gain for the hospital. And so we no longer had to kind of try to be under the radar every time the budget came up. So what I would say to people prospectively is the most important thing, and I think you'd agree with me on this, is to really deeply know what your health system, what your group, whatever are their missions. Are they in value-based care? Are they in fee-for-service care? Are they aligning with one of the or many of the quintuple aim?
Aim. Yes.
and start with that first and foremost. How are you going to help them rather than how are they going to help you
Yes.
fulfill your passion, right? And your beliefs and so forth. So I think the alignment with organizational goals becomes very important. So
Mm.
that became clearer when I went on to develop a program in the just before the pandemic, which was a broader program in lifestyle medicine because I was more educated. I was now board certified in lifestyle medicine. I wanted to bring the nutrition, I wanted to bring the stress management into the broader population for the hospital. Now, my hospital was still fee for service in this, so I didn't have quite the same ability to align with some of the quintuple aim, but I had the ability to really, and the opportunity to really take that interdisciplinary care model and
Mhm.
build it into a service line for the hospital and to draw more patients in that just did not just have cardiovascular conditions, but also had diabetes and cancer and weight management issues and so forth. That was a much more creative and innovative way to build that, and I know that many of our members now have been able to successfully take that in again into the model and the priorities of their institutions.
Yes, and I relate to what you said, especially because I worked in a health system as well. And I always tell everyone that it is not about what your passion is or what you want to do. It has to align with broader mission, vision of the institutions, and obviously the financial models have to be fully aligned with what you want to do. So I'm glad you brought that up. In your roles with the American College of Lifestyle Medicine, what strategies did you find most effective in advancing integration of lifestyle medicine into mainstream healthcare?
Yeah. Well, it was so important, has been through the years at ACLM, I know. And so, I would say the first thing was really, and it preceded a little bit, I was on the board and not during my president term, but it's the board certification,
Mhm.
standardization of the field in terms of education and distinguishing the field from other um, types of medicine, integrative medicine,
Yes.
particularly distinguishing it from the wellness
Yes.
industry, from the heavy nutraceuticals and supplement industry, because those are sort of, if you will, rat holes that people can go into immediately when they think of lifestyle medicine. And so trying to put, really a crisp definition and on that and a standardization and through board certification. And then I think the other thing that really helped is the recruitment of health systems, and that has been progressive.
Mhm.
And these lifestyle medicine champions, that have come from these organizations, and again, bringing that message into their organization, and as we just said, doing a more measured approach of aligning
Mhm.
what they want to do with the organizational's mission. Um, and then I think the third thing would be, gaining the AMA delegate status. I think that's been a very important step for lifestyle medicine. And we're really, bringing that whole message of ACLM and the model of which, and the pillars of lifestyle medicine to awareness so much more broadly through this large delegation from every state and every specialty
Yeah.
society, across medical school trainees and so forth. And so it really has, I think, started to take again that concept that this is something alternative or something out on the margins and really bringing it in to mainstream medicine into really a group of medical professionals who are very dedicated to patient outcomes, which we are in lifestyle medicine. So it's a beautiful marriage.
Yes, yes. And I remember you and I worked on this current lifestyle medicine definition that we have
Right.
to really bring about the value proposition of
Yeah.
lifestyle medicine. So, yeah, thank you for all that leadership over the years. So, tell me what simple, actionable first steps would you recommend for clinicians who want to incorporate more lifestyle medicine into their practice?
Right. So I would say first and foremost something that you would expect me to say, but I really would say it strongly to the audience, which is to join ACLM.
Yes.
Yeah, it is it's a refreshingly welcome organization and resource rich, not
Mhm.
just resource rich in terms of the staff, which is true, but also the members, because they are all passionate and capable of helping somebody and mentoring somebody who has an early interest and kind of help them fast track, and
Yes.
learn from their experience to be able to fast track their successes within their clinical practice or within their health system. Um, so that's what I would say. And then I think I would say again would come down to this. I think maybe a measured and data-driven approach,
Hmm.
actionable steps. So try not to fight the system, try to add to
Yeah.
whatever system is. Uh, take on some pilots that show proof of concept.
Hmm.
I think there's several ways, and again, I just can't say strong enough just how much people will be welcomed and matched with mentors, whether
Yeah.
it's member interest groups or even more formally or at the national conferences. And it's really that folks can benefit now, but you and I less so if we go back, but just in the last 5 years could always
Hmm.
find somebody who has done something that's very aligned with what you intend to do, and they're very happy to take you through their journey.
Yes. Yes. People are very generous in terms
Yeah.
of sharing their knowledge and expertise and what they've learned and what has worked and what has not worked. So I agree. So before we end, I wanted to ask you, what is your vision for the future of our field? And how do you see lifestyle medicine shaping the transformation that we're talking about in this country?
Right. Well, I think the future is very, very favorable for lifestyle medicine. I think we're still very early in
Hmm.
the journey in bringing this awareness. I think that, I'm going to use my lens right now, which is through the AMA, in just saying, 3 years ago, when I was a representative for ACLM, not yet a delegate because we hadn't met that delegate status over a 3-year transition period, you know, I would say people were not as welcoming. I wouldn't
Hmm.
say they were unwelcoming, but, they were just more unsure about what this lifestyle medicine whole
Right.
was and whether it was for real or whether it was just a lot of puffery or something. So
Hmm.
it became kind of different. Now, was that a result of just immersing ourselves there, or was it a result that I don't think so. I think it was a result that in the last year or so, when I would introduce myself and my status as representing the American College of Lifestyle Medicine, it was more likely that people would say, "Oh, yes, I've heard of that field. And
Hmm.
I know a clinician, my friend, my colleague, who has been to the conference and who is so excited about this." And so, um, I think that the physicians, I think the populace is ready for it. I think the
Hmm.
AMA is ready for it. The incoming president is board certified in lifestyle medicine, which I think is a great testament to the field.
Absolutely. Hmm.
And I do think we're primed, and I think we're just at the beginning of seeing this be integrated more broadly and meeting so much of what we want through the quintuple aim and all the missions there. So
great. Thank you. Couldn't agree more. Cate, it's been a pleasure speaking with you today. Your wisdom and insights are deeply appreciated. Unfortunately, we're out of time, but I'm grateful for the meaningful conversation we've had. Thank you to our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.